Hi, everyone. Good morning, good afternoon, and good evening, wherever you are in the world. My name is Elena Ateva, and I'm with the White Ribbon Alliance, one of the partners on HP+. My colleague, Aya, from India and Malawi, unfortunately could not join us today because of technical difficulties. So I'm very sorry, but you're stuck with me today. Today, I want to present to you a very simple yet effective innovation, and that is asking our clients, what they want, starting our programming with that one question. What do you want? What do you need? And that's exactly what we did in the What Women Want campaign. We went directly to women and girls 14 and over and asked, what do you want for your own reproductive and maternal health care? And we asked and received answers from 1.2 million women and girls around the world from 114 countries. It was really transformative for women and girls to be asked that question, because they are never asked what they want. They always are worrying about somebody else. So even asking the question puts the power back into women's hands and helps them determine their own fate. And that's why it's a gender transformative approach. We, as a result of that campaign, we mobilized an upward of 20 new policies, more than 15 million in new resources, and helped recruit more than 5,000 healthcare workers. I want to focus on two examples of how the campaign impacted specifically respectful maternity care, and that was by far the first answer that women and girls gave us, that they want respect and dignity in the whole gambit, right? From the reproductive to maternal to childcare. In India, we received responses from 325,000 women and girls. And in any country, really, we were looking to mobilize enough women so that their voices would not be ignored, right? In numbers too large to ignore. So, based on the size of the country, we determined for India that's a good number to mobilize and ask that question. And the government responded. In terms of ensuring respectful care, there were several very important initiatives that the government of India and the Ministry of Health and Family Planning in particular undertook. One was the election initiative, which ensured respectful care in units, all government facilities really, that focus on maternal and newborn health. They also ensured that provider education and facility certification includes respectful care, so that you cannot continue to provide services or continue to function as a facility unless you meet certain standards to ensure that respectful care is provided. And we also mobilized women, continued mobilizing women through public media-facing campaigns, so that women themselves understand their rights and continue to demand them. In Malawi, we mobilized more than 80,000 women and girls, and respectful care again came top on their mind. As a result of their demands, respectful maternity care and respectful care was included in quality improvement checklists developed by the Ministry of Health and Population, and was also incorporated into regulatory tools. So these are tools that regulatory bodies use to when they go into facilities to determine whether they're meeting standards and can continue to operate as such. We were really heartened to see that the Ministry of Health and Population even included respectful care in the FP and maternal newborn health guidelines during COVID. So even during a time of crisis, the ministry realized this is such a critical part of the delivery of services that cannot be overlooked. And the ministry ensured that the pre-service curricula for nurses and midwives is also updated. It includes respectful maternity care. So we did the initial campaign, we did it the old-fashioned way. It was really on paper, and we were mobilizing through volunteers in communities, really walking up to women and asking them that question and filling out the survey. What we are proposing here today is really a way to streamline this, to make it easier, both to ask different questions, really, not to be restricted, but also to be able to get the answers and analyze the answers in real time. So be able to for example, spot hotspots in any given country on how women are responding, and be able also, very importantly, to get back to women, to let them know what happened as a result of voicing their demands, which is very important to each woman who shared with us. So we created a chatbot. This is really technology that utilizes WhatsApp. It's very easy to use for the user. It could be translated, so it could be used in many different languages. Could be utilized really for asking any open-ended question, and that's the gist. You're asking an open-ended question so that the respondents determine what is important to them. And then you can analyze it. Like I said, you can see what is coming up and where geographically, and you can engage with those people you've mobilized. So whether it's periodically, you want to send them updates, or whether you want to ask any further questions, you can do that. That is really, for us, we see it as a time saver, but a very efficient way to ensure that everywhere and everyone is using this, and that the way we do our work is essentially changed, so that we always start with our users, with our clients, and what we're creating is truly responsive to their needs. We'll be launching the chatbot later this spring, and I've included our website so that you can check later on if you're interested in utilizing it, and you can learn more about it. So I'll turn the question to you now. How do you imagine you might be able to use the chatbot in your work? What are the questions that you truly want to ask the people that you're serving? Over to you. Carol? Nice
Hi,
to see you,
Elena. I'm so
Carol.
glad to see you and hear about this work. It's great. And I'm just wondering if there's a further effort to include increased service for medical doctors.
Yes, absolutely. So depending, right, in Malawi, I talked about nurses and midwives because that is the major workforce in Malawi. But in India and other countries where we're engaging with providers, really all types of providers. So OBGYNs, definitely, pediatricians, and working through the professional associations is a great strategy. Involving them in research so that they see firsthand, what's happening, including in the What Women Want campaign. Once you hear that many responses, and these are very detailed, heart-wrenching stories sometimes, it's just very hard to ignore that this is an issue. So definitely focusing on all types of providers who have any interaction with women and girls.
Great work. Thank you.
Thanks for this question. Any other burning questions you might have, either about the campaign, our approach, or the chatbot? Do you think if you work in another area, let's see, either family planning or HIV/AIDS, do you think that might be relevant to your work? Thank you, Josephine. A very important question. So Josephine is saying one of the challenges of achieving respectful maternity care is the issue of staffing. Healthcare workers who talk about being overworked and don't have time for personalized care. Absolutely. And I think it's not, you cannot give what you do not have. So it's very hard if you, as yourself as a healthcare worker, are mistreated, and whether that's understaffed or not paid on time or any number of things that unfortunately happen to healthcare workers. So it's unfair to expect them then to deliver either quality of care or respectful care. I think that any efforts to improve quality, respectful care have to go hand in hand with ensuring that providers are well supported, that their staffing numbers are increased, that they're paid on time, that they're respected. So in our work in Malawi, that was a critical strategy, was to advocate for additional numbers of midwives, additional positions to be opened, and additional midwives to be hired, but also for a career pathway so that midwives can advance in their chosen profession and not advance as nurses. And that they're respected in their own right, because otherwise people don't want to enter the profession if it's not seen as a respected profession. So that was a critical part of the work that we did together with the professional associations in the country to advocate. And I think it was very important for the midwives to see that also women are asking for midwives to be better supported, that they're not just asking for respectful care for themselves, but they're asking for the whole gambit, right? The whole workplace to be improved so that they can receive better care. Thank you, Bev, for this question. Bev is asking, from your experience, how do you see the link between respectful care and joint community health service accountability? Accountability is such a critical part of this work, and that has to be, again, continuous, and it has to be participatory. So the community women themselves need to be part of the accountability mechanisms. And we have employed a number of them. So, I mean, the What Women Want campaign, you can see as an accountability mechanism, right? Having women say what's happening and ask, demand for change. But in many countries, we also used others. So in Malawi, for example, used citizen hearings as an accountability mechanism where the community and the providers and decision makers are coming together really to discuss mutually beneficial goals and how to achieve them. We trained midwives as citizen journalists so they can share their stories and they can share what was happening. So a midwife would say, for example, yes, I'm not in the facility, but that's also because I'm the only midwife 24/7 and I cannot, be in the facility all the time. I don't have time to go to the bathroom. I don't have time to sleep or to eat. And that's something then, again, for the community and for the decision makers to discuss and to demand changes, to demand additional midwives to be hired, and to reach out to central government. So any of those strategies, and what I would say in terms of accountability approaches is that we used many different strategies at the same time, working through the media, women and midwives sharing stories. That was really what made the change happen, is that decision makers, policymakers were hearing from all different sides at the same time, and everybody was saying essentially the same thing. We need more midwives, we need this to change, we need midwives to be better supported, and we need midwives to deliver respectful care. Laura is saying, I think it could be useful for family planning as well. It's important to understand people's needs and desires to ensure that they can make the best method choice for them. Yes, absolutely. And if you look at, then, the results from the What Women Want campaign are publicly available. There's a database. I can share the link in a while. And you can search yourself. But in terms of family planning, what I remember a lot of women saying is that they wanted more information about side effects, for example. So that's definitely something we want to know and be addressing right away. Any differences? Thank you, Umar. Great campaign, simple tool, relevant in most settings. Any differences in uptake and why? I think it mattered who is asking the question, and what made a difference and could make a difference is really how you're mobilizing. Even through a WhatsApp tool, the best way to mobilize is through local actors, right? Organizations that are already known in the community, are well trusted, and women know that their responses will go somewhere. Something will be done about them. That was essentially the first thing women asked was, why are you asking me and what will happen as a result of me telling you that? So that is the biggest difference, I would say, of whether a campaign makes it or not in any given place, is who is mobilizing, who is asking the questions. Do women trust that organization or individual? And I think that's why it's also very important to have that feedback loop with women, and through the WhatsApp tool, you'll be able to do that because you can also tell women what happened as a result. You can let them know that, for example, there was a policy change, or that there were more midwives hired, or something, something that makes a difference in their daily life. Because essentially that's why they're doing this. That's why they're participating. They want something to change. And we want to make sure that they know about it and are feeling the difference firsthand.